Welcome everybody to today's podcast at Studio Adele, and I will be your host for today. I am Nurse Favor, and with me we have someone I have always looked up to, someone that I have always prayed to, get to their status one day. But I would leave her the honor to introduce herself properly to the audience, so you'll get to know her and admire her as much as I do. You have the floor, ma'am.
Thank you. Good day, everyone. My name is Dr. Mrs. Adeola Odedoyin. I'm a Chief Medical Officer at the General Hospital Alimosho, Igodo. My specialty is pediatrics. I also have an MPH, and so I'm a public health physician. I'm married to Pastor Benga Odedoyin, and I'm actually a pastor's wife as well, and a gospel singer. So, yes, I also have a diploma in theology. I have a diploma in theology too. So I'm so glad to be here. Thank you very much.
All right, Ma. So we welcome you once again to this studio. It's such an honor to have you here in our midst.
Thank you.
All right, so we have a couple of questions in our healthcare system. Things that are really bothering us. These are something that affects each and every individual in our country. So we'd love for you to shed more light on them, and you can address them and even give solutions that are concerning them. So, shall we proceed?
Yes, please.
All right,
Thank you.
So for the very first question, I would love for you to shed more light on this. What do you think, or what do you feel is actually happening in Nigeria healthcare system? What do you feel the issues are? Why are people so hesitant to, seek for healthcare services? Why is the healthcare system now being compromised? Most people feel like if you don't have the funds to, then there is no need for you to seek for healthcare services, which I feel like should not be so. Most federal institution has zeroed most people's mind to believing that, it has to be based on your monetary system, monetary value. If you don't have money, there is no point for you coming to the hospital and all of that. Why is the healthcare system already bastardized? So I would love for you to shed more light on that, ma'am.
Okay, thank you so much. There are issues with our own healthcare system, and I want to believe that countries where they have a very good healthcare system, that they also had to go through what we are going through currently before they got to the stage where they became, people that we look up to. That's like the international world. Concerning the issue of funding, there are some countries where it's not out of pocket. There are good insurance policies. And so when you get to the hospital, the government has already taken care of a lot of the expenses that have to be paid. But concerning our own healthcare system currently, it's out of pocket. And so it's sad that if you get to the hospital, if you don't have money, there's a limit to what can actually be done. So I think that's part of what is happening to us here. So I think for a solution, it would be good if we could actually have a system where we also have good insurance, policies in place that guide our healthcare system, such that when a patient gets to the hospital, because some of those countries where there is good insurance, it's taxpayers' money. So there should be a way that the government is able to, take care of the taxes we are paying to be able to ensure that we have a good healthcare system. So I think, trust. I think our country, where you have so many 419ers and all those things, I guess those things also, the lack of trust, I think that is also affecting us. But I pray that we will get there. Then, yes, we also said that some people are losing trust in the losing trust in the healthcare system. Well, I think that might be probably because of the recent, strikes, particularly in the government hospitals. You find that a lot of strikes happening, and it was sad the last time. I didn't even get to know the seriousness. Although some people, are telling me some things that happened, They saw some patients that had just had babies, the mothers were on drip, there was nobody to take care of them, There were some things like that I really felt sad. But what is happening? Doctors are not happy. Healthcare people generally are not that happy.
Yes.
They're not like the people abroad, where you see a doctor and you know that, yes, this person is made. It's not like that in Nigeria, And so when you compare yourself with international world, sometimes doctors are not really, and from time to time, they have to remind the government that you need to do something better, and in the process, when they get frustrated, there is no other solution but to go on strike, And so when you want to come to the hospital and you are hearing they are on strike, you'll be looking for other alternatives, so that if these people are on strike, are they the only people, that's it. And then apart from that too, that there is this Japa syndrome,
I was about to ask that too. Yeah.
As Japa syndrome, you come to the hospital, the doctors you used to know before, they are no more, to be found. I believe that there's some confidence and some patients have when, that is this doctor that you met the last time, and this doctor is, you're looking forward to meeting the same doctor. But, everything boils down to the fact that, the financial issue has not yet been handled well by the government, and I feel this taxpayers' money. And apart from that also, there's supposed to be the part of the money budgeted for health in every country.
Yes.
We find out that for more developed worlds, it's about 15% of their budget. But in Nigeria, most of the time, if you can get about 4%, that's the best the government is doing for us. So when it's 4%, how can you get, high standard equipment to do all the things you want to do when the money there's no money there? You want to make the environment, improve the aesthetics of the environment, make it beautiful, make it attractive. But the money is not really there. So I think it's something that government, people in the government need to really sit down, and look at the priorities, I think health is a priority.
Yes.
So we should be doing much more, for the health sector. So until when we get that right too, because I believe out of that is what they used to pay for the staff,
Yes.
and make everybody comfortable. So there is a lot that is not really going right. So I pray that very soon, the government will be able to do something about remuneration for health care workers, because that will make them happy. You come to the hospital, you see everybody happy. They're happy doing their job, not grumbling, and being irritable,
Yes.
at the slightest thing, So I think those are issues that we need to look at to be able to make people have more confidence, in the health sector.
All right. So I do feel like, to the best of my knowledge, following up on news, politics, there is an amount that is always being budgeted for health. Every term, every session, there is always an amount. Commissioner of Health will even come out to say, oh, this year we're giving this million or billion of naira to the health sector. But as we know, Nigerians, their politicians, most of them pocket that money. Because I remember that there was a particular fund that was given for HIV, AIDS, cervical cancer screening, a whole lot. Government decided to give it out. But at some point, the money was actually not well distributed, like it was not well given out to places. So some people were having it, while some were not even having it at all. Whereas there were some that, let's say, they were able to complete first phase of the treatments, then they had to stop, So all of those things just really discourage them. But I feel that would be a discussion for another day. So, yes. Thank you very, very much. So on to the next question. What do you feel is a full body check? And why do you feel everybody should go for a full body check? For me, I actually feel it's, head to toe assessments. That's what we nurses. It has, you go to the hospital, do a full head-to-toe assessment, from physical assessment to observation and all of that. But I really want you to shed more in-depth light to it. What do you feel a full body check is, and how often should it be done? And is it based on age, gender, race, or any of that?
Okay, so a full body check for the doctor starts the moment you walk into the consulting room. There are things that the doctor will pick up, even with your gait, your expression. There are some things that the doctor can pick up from there. And then we'll take a detailed history, because everybody is different.
Yeah, sure.
Your religion might affect some things, your sex would affect some things, your occupation, whether you are married or you are single, whether you are the first child or whatever position you are, all those things we need to ask. That will give us a good picture of the person we are dealing with. And then from there, we move on to examination, general examination of the patients. Yes, I mean that's when you can call the head to toe, because in a good examination, you actually do that. And then from the history you have taken, you also be able to know which system you need to focus more on.
Yeah.
Although you try to make sure that you do a full examination of all the systems. And then after you've done the examination, you'll be able to come up with a diagnosis. Is this person healthy? Are there issues that need to be tackled? From there, you now move on to investigations. So you'll be able to know which investigations you need to do. There are some investigations we call general investigations, like the blood checks.
Okay.
Do a full blood count. That tells us about your level of your blood levels, and we can also from there check if there's any infection, anything suggesting infection. Then we can do electrolytes and urea. Those tests will also give us a pointer to how the organs are functioning.
Yeah.
And if everything at that level is okay, you might not need to do any other major investigations. Okay, of course, you can also do the urinalysis, yes, check the urine. From the urine too, we can also pick things, do the blood sugar tests. Okay. So if everything is fine at that level, you might just want to give the person another appointment later. But if there are other things we are picking up, or your diagnosis is suggesting some other things, then you have to go into more elaborate investigations. You want to do a CT scan, there are different kinds of scans, that we call imaging. You want to go into imaging, and then there are a whole lot of other tests, biopsies and all that, depending on what diagnosis you are looking at. But if a patient is healthy, well, you may just want to ask the person to come in from time to time. The person is a child, and it's not like you've detected that the child has sickle cell or has any syndrome, like maybe Down syndrome, that you need to see from time to time. Well, you can just do it roughly. There's no hard and fast rule, but if the patient is healthy, and you just want to follow up, maybe for a child might be, well, maybe I shouldn't say anything because it's not actually documented.
Yeah,
but it's just that if a child is healthy, then he's healthy, and just come in from time to time. What is more documented is, for older people, maybe from like 40 years, Although for children too, you want to do their dental checks, you want to check their eyes to ensure that they are seeing well,
Okay.
or in class so that they are actually hearing well. So there are investigations for that, Then for adults from 40, they also have to do their dental checks from time to time. I think it's twice a year you're supposed to do a dental check, and then also check your eyes, And then if a patient has been diagnosed with maybe diabetes or hypertension, all those, so those infections, you need to have regular appointments, as the doctor that is managing the patient will give the intervals that they want. But if the adult is healthy, 40, and you are healthy, maybe 5 yearly health checks, 5 yearly health checks, and you do the different investigations that need to be done, monitor blood sugar, monitor your blood pressure, and as you continue to do those checks, if there's anything getting up, trying to spring up, you'll be able to nip it in the bud on time. So it's regular, it's good to do those checks. So, but by the time you are getting to like 50, you might want to do it more often, maybe like every 2 years, every 3 years. There's some tests that women also need to do, from time to time. The cervical screening,
Sure.
Yeah, those ones, as you grow older too, the interval of doing them also becomes shorter. So those are the checks that you need to do to ensure that if there is anything, we start addressing it on time, because that's the most important thing. Preventive medicine, but unfortunately, it seems we are not doing so much of that. Most of us wait until when there is something, and that makes the prognosis kind of poor. It's good to start early, nip it in the bud on time.
Thank you very much. I really
Thank you
learned
too.
a whole lot
Thank you.
from that. But I was really expecting, for you to shed more light on sexually active women, especially, the kind of test and how frequent they should actually go for such tests, because there's a particular trend now going on since January, I think, about HPV, getting the vaccine. I even heard that now there's HIV vaccine too as well. So they are like every young woman is going ahead for it. So I was expecting more towards, nowadays we have women that are exposed to sex and different kind of activities. So what kind of test again do you recommend such women?
Okay, for sexually active females, well, yes, there are some tests you need to do. I think there's one that is called you want to check for trachoma and all those other vaginal infections, because actually for ladies, there's some infections that they have that you won't see any symptoms.
Yeah, sure.
There won't be any vaginal discharge and all that, so they actually need to do those checks, be every 6 months, every 1 year. Yes, for the human papilloma virus, it's been known to cause cervical cancer.
Yes.
So the vaccines are actually to be given much earlier. When the girls, I think in their teens, is when we're actually supposed to give that vaccine for it to work, for it to be effective. So that's for the human papilloma virus. The HIV vaccine, we are still working on it. I have not heard, I've not seen it.
Like I said, it's a particular trend. I've been seeing
maybe abroad.
Come with me to get vaccine for HIV, and I'm like, when did this happen?
I'm not aware of that in this part of the world.
Okay,
Yes.
all right. Thank you very, very much. So let's quickly go next to the next question, and this will be pertaining pregnancy. And I feel this is something I would need you to really shed more light on too as well, and also share your experience. What are the things that you feel like women should be prepared for?
Thank you. I just wanted to address the previous question a bit better.
Okay.
Yeah, because, many people in the sexually active age group are actually adolescents. And we find out that, that period of adolescence, they don't like to talk. They don't like to complain about anything. And that could be really serious, because it's like a silent killer. So if one is sexually active, from time to time they need to have those checks that we were talking about earlier on. Need to see at least come for those tests. And then if you actually have symptoms, like for a lady that has a vaginal discharge or having unusual abdominal pain that needs to be investigated, or for a young man that is actually having maybe a discharge or having pain when passing urine, it's important that we see a medical professional on time. We have to forget about the fact that, we feel we are very mature and in charge of everything, and we are unstoppable, because that's what happens to some of our our adolescents. Because if one does not address these issues on time, they can lead to infertility later on. And that is usually very, very sad. So all those things need to be curbed on time.
All right. Thank you. And I also feel most people are quite hesitant when seeking for healthcare. You know, they always feel like, oh, seeking for healthcare services is something we should refrain from. Do you feel it's as a result of ignorance or probably other issues that we are unaware of?
Well, it could actually be ignorance, but I think sometimes it's because of our fast life. You know, in Nigeria, people working class, if you can do up to 3 or 4 jobs, you want to do it.
Yeah, sure.
You know, and then women, you have to take care of the home, take care of the children. So sometimes you might be seeing some things, but you just close your eyes to it and feel it will go. You know, but many of those things don't go. So we actually have to have a culture wherein, you know, the moment we are seeing anything that is abnormal, we actually cry out for help immediately so that it doesn't become worse and become more expensive. You know, because if we're able to address it right from the start, you know, we're able to address it better and more completely at a lesser cost. So we just have to talk to ourselves. And then also, it could also be ignorance. You know, ignorance. I don't know how we're going to get around ignorance, because if you are ignorant, you're actually, you know, just ignorance, you know. But the moment you are saying anything, actually, because it's your body, you need to cry out on time. And we have a lot of departments at the General Hospital, Alimosho, where I work, you know, where we can address these things.
All right, thank you so much. So I feel we have learned a couple of things, you know, starting from this screening and different tests, different age group, gender, sex, and every other perspective should perform, and the frequency in which they should go for such tests. So to another issue that is concerning our country, pregnancy. Do you really feel a woman is well prepared for pregnancy, or what do you feel she should be known of or known for before she actually gets pregnant? That's before, after, because most times I see even after pregnancy, most women tend to lose themselves. Then we start having issues with postpartum issues. That's when they'll start coming out with problems that they have never had before, diabetes, hypertension. Even some of them will lose their sanity in the process. So what do you feel are the things we should let people be known for before they get pregnant, after pregnancy, follow-up, counseling, or any of that?
Okay, thank you. Well, you know, pregnancy is actually divided into 3 phases. There is the pre-pregnancy period we're talking about.
Okay.
Then there's the actual pregnancy, you know, and then there's the postpartum, you know, like we are talking about. And there are different challenges in each of these stages. One of the things that we need to look at for the pre-pregnancy period is the fact that we want to ensure that the baby being born will be healthy. And so we are encouraged to start taking vitamin supplements, particularly vitamin A, because there's something called neural tube defects that you don't want to happen. You don't want to happen.
Okay.
So you need to, but you know, the thing is that they say about 50% of pregnancies are unplanned. But for the ones that are planned, and once you actually get to the childbearing age, you know, you should actually be taking these supplements, particularly vitamin A, to prevent any of these negative things. Then also, pregnant women need to, getting into pregnancy is just another stage of life. And it's good to be prepared. Yes, your body is going to be changing. You know, you're going to have your stomach bulging and all that. It doesn't make you ugly or anything. But you need to put in more effort to ensure that you are still looking as smart and trim as you were, you know, before you got pregnant. Then yes, in pregnancy, sometimes you might lose appetite. You might not be able to eat some of those things that you would love, you know, you used to love, you know, for that period. And then they could even be vomiting, you know, and all those things. But usually those things last for most of the times, 70 to 80% of pregnant women, within the first 3 months. After that, the lady begins to be able to balance out. But it's good to know that it could actually be bad, it could really. So it's good that before you get pregnant, if you are planning it, that you get most of the things that you will need ready. So it's not that time that you are pregnant that you now begin to start looking for some of those things, maybe when you can't even move around. So those are things that one needs to prepare for. Then also, it's called a period of confinement. You're actually confined. There are some things that you might not be able to do, but one needs to have good support around, good family members, that can encourage us. Because sometimes you might actually even get to a period where you feel so depressed, because, maybe there are some things that you expected. You are extra emotional. You are very sensitive, Some things that you probably will not take as an issue before. If it happens or they say it, you might start crying.
Yes.
Or you get easily irritable, But with God on your side and good prayers, one is able to get over these, and with good support system. So sometimes I feel for maybe single
mothers.
Yes. There's sometimes when you need somebody to rub your back, and all that. But if people are there, sorry, I'm speaking Yoruba. We don't know why this person has now gone to get herself into all this. It's time, and people are not there to support. It can be really bad. Then also, some pregnancies predispose people to developing diabetes and blood pressure, and that's why we need to go for our antenatal checks regularly, with the doctor, so that all the screening tests can be done, so that if there's anything like that, you can be well monitored at the time of delivery. For many people, when they have the baby, the blood sugar goes back to normal, blood pressure goes back to normal. But for some, you need to still continue to monitor it after delivery, because some people have been known to die from a stroke because they felt after having the baby, that was it. But you still need to have the monitorings to be sure that you are free of whatever it is. Then also, when you are your baby, one of the most important things to monitor for the baby is the level of jaundice. It's so sad. There are many times you have a healthy baby, but because the jaundice level was not monitored, at the end of the day, the baby has something we call kernicterus. The baby has a mental retardation. Wow. Because of the level of bilirubin that was released into the blood. Now, most babies have a bit of jaundice, but there is this severe one that needs to be monitored.
Yes.
So that severe one is not ampiclox, so it's not antibiotics. So if you have jaundice and you are using you think it's ampiclox, then it's because it's not the severe type. If it's that severe type, you have to start what we call phototherapy on time. Yeah. So we can start addressing. And then if it's still uncontrollable, we can prepare to do a blood exchange on time before it gets really, really bad. So that's that. Yes, some mothers have mental issues after, Usually that occurs a lot when there's not a supportive, maybe there's an issue, there. So that can happen. Then also for being able to breastfeed very well, usually we advise that whether you have a CS to have your baby or you have the baby normally through vaginal delivery, within 2 hours max. For normal delivery, you can take it down to about 1 hour, 1.5 hours. You need to have started breastfeeding your baby. Sure. And if it's a CS, by 2 hours. But many mothers don't know this. And when you don't start it on time, to now have a good milk supply might be very difficult. And so you now see people having to support with formula, which is not what you really want to do.
Yes.
Because you want to do 6 months of exclusive.
Yes.
So that means that you need to have prepared yourself well, that after you've had the baby, thank God, by God's grace, there's still another journey that has to go on to ensure that everything is perfect. So I pray that God will give us that grace.
Amen.
If the medical people are not telling you that you want to breastfeed, you get prepared to breastfeed because maybe there is overwork, everybody has Japa, you need to also be telling them that I want to breastfeed this baby. I've been informed that within 1 hour, within 2 hours, I have to start breastfeeding my baby, and that would also help a lot of things. For the psychological aspects, like we said, if there's a supportive environment, that doesn't really seem to occur as often, although it can still occur. But the moment that the people around are noticing anything, and you try to support, counsel and all that, and it's getting beyond that, then you need to see a psychiatrist. It's, I don't know, many people don't like to see the psychiatrist. They don't like the word psychiatrist,
Yes.
but it's not only, that particular kind of thing we're talking about. It's not the normal thing that you say is a mental person, If one is able to address it on time, it might not become something too bad. But when we leave it, we don't address that particular one, it can really be, it could be disastrous,
All right,
So.
we have heard it all, and from what she has said so far, we understand the importance of pre-screening even before pregnancy, during that particular phase, and afterwards too as well. But there is something that actually bothers me. I have always asked myself, how do you diagnose a special need child? Most people just give birth to autistic kids, kids with Down syndrome and all of that. How do you diagnose it right from pregnancy before it starts to manifest? And also, what's your take on it? Would you recommend they keep such a child? Because I have had a particular client come in with the issue of, oh, we realized that this child was autistic or this child has Down syndrome, and it was so severe. So they were contemplating, should we still go ahead with it, or should we just let the child go back to God, as they said in their word? So I really need your take on it. What do you feel should be done in such a case, and how do you counsel such couple?
Okay, like we said, like you've said, yes, there are some tests that can be done, to pick up some of these things we are talking about, Down syndrome, autistic child. There is the alpha fetoprotein, which needs to be monitored, at a particular period during the pregnancy.
Okay.
And this can give us a pointer to the fact that the child might actually have maybe a neural tube defect or something like that. Now, the issue about keeping the child, you can only counsel the family because people are going through different situations.
Exactly.
So they are the ones that will need to make the final decision. You tell them, all about the disease, what to expect, and then you counsel them. I'm a Christian, and I'm not likely to say you should, but I know that there can be challenges,
Very.
So it has to be something that you have prepared your mind, you are prayerful, and you are trusting God, And then there might be other reasons, but it's that couple that has to decide on what they need to do. We just supply the facts and the information around the challenge.
All right. Thank you very much.
Okay.
I'm really loving the vibe from this. So there's this trend again about getting our body done. Everybody's either getting a filler done, BBL, liposuction, lip filler, different sort of things, And I'm always like, what is with this trend? Is it social media that is really influencing this trend? Everybody wants to be perfect. And why do you feel they're actually doing it? Is it to boost their self-esteem, or for a man, or just so that they can fit in with the society and all of that? So I really need your take on this.
Okay, now I believe that there are different reasons why people do different things.
Okay.
Well, I think it happened to me some days back. I actually saw an outfit I liked, and I was talking to my tailor that, can she make it to be like this? And she was like, this design, it's not about the tailor, it's about what the person has done to her bum. But it really made the outfit look very, very nice. So, well, for some other person, they might think they want to make their bum like that and go through whatever it is, But from my own Christian background, I would believe that if you are thoroughly grounded, as a Christian, you have learned to understand that you are created uniquely. You are created uniquely to be able to achieve what God wants you to achieve in life. So it is being satisfied with the way God has created you.
Okay.
Being satisfied, because you're supposed to perform a function which another person cannot perform. So we should stop trying to be like the other person. we've been created short. Why should you want to be looking for somebody trying to be tall? You know, you are light complexioned. You know, why should you want to be black? So I think it's contentment, because these things like we have been talking about, they have complications.
Yes.
We have had somebody very prominent in the government, you know, that lost her life because she was trying to change, you know, I think do some other things to become more attractive. But really, attraction, is it really about the physical? Let's look at it. Attraction is not completely about physical. It's about what is on the inside. It's about what is on the inside that, you know, you can have a guy that is, okay, maybe they are twins, you know, and the guy, maybe one of them feels that the guy likes both of them, you know, I don't know whether that happens, you know, but it's just that it might not be what the person is going to do on the outside. It might make him be attracted, but that attraction will not last. It's not about what we are doing on the inside. Have we allowed the word of God to transform you? That's what makes people attractive. So I think it's something we need to be careful about, particularly when there are side effects associated with that.
All right. Thank you very much.
Thank you.
So I feel, you know, as time change, people also change. Our way of thinking too is also changing. You know, nowadays people define their own term of being attracted to somebody to another level. They feel like if you don't meet up with a particular standard, you know, they won't feel that attraction to you. And they feel like that attraction is what can lead to love. Then from love, it will lead to marriage and all of that. So Gen Zs, we have it hard. So most of the times, the way we think is really what shapes us to doing certain things. Well, that's from my own point of view anyways.
Yeah.
So,
but can I just add to that?
Okay, sure.
I think what I'm trying to say there is that if someone is attracted to you because of your physical, it's problematical. Because there are going to be times when, particularly when a lady is even getting older, you know, some of those things will not really be there again. But if he is attracted to you because of who you are, your personality, now that is someone that is most likely going to, that's a marriage that is most likely going to work, because it's what is on the inside. What is on the outside can be changed by different things. So we need to be very careful and, you know, work on what is really important. Work on what is really important.
All right. Thank you. I am really loving it and learning a whole lot too.
Thank you.
All right. So I think on Friday, I listened to a news talking about how 6 doctors were suspended, license was revoked due to negligence of duty. From the information that was passed, I was not there, but I heard that a 12-year-old died on their shifts due to negligence of duty. So I really want your take on it. What do you feel this negligence of duty is, and what do you feel is actually causing it? Because I have a whole lot in my mind, but let's hear from you first.
Okay, now, the issue of negligence, it's not only in Nigeria that it happens. It's just that, you know, one of our challenges here in Nigeria is that we don't capture data to know exactly how often it happens. Okay. Like in the Western world, in the US, about 10% of patients that come to the hospital have been captured at some time to have a poor outcome. 10% out of that's like 90% get what they want, but about 10% because of negligence. Even abroad, it happens. That's because the human being is not a perfect individual. Mistakes can occur. But it's just that many of the mistakes that occur, it's because of the way the practices. The way the practices. For instance, now, if you have fewer doctors in a place working because most people have traveled abroad, that means the sad thing about it is that if there were 10 people working before and 5 people traveled abroad, it's the salary of those 5 people that they will still get. Oh.
Exactly.
They are not going to add the salary of the 5 people that went.
Yes.
Meanwhile, they're going to be doing the work of 10 people.
10 people. Mm-hmm.
So at the end of the day, the environment, the situation in which the doctors find themselves sometimes makes them more prone, to be found negligent. Then also there need to be some policies, in place, that need to be monitored. Policies are more like the laws that govern the profession.
Yes.
And those policies need to be monitored. For something that helps also is this issue of quality improvement. I was opportune to be the quality improvement director in my hospital for a number of years, for my tenure, and there are some standards in quality improvements that you have to measure up to before you get signed up, as a good hospital. Ali Mosho General Hospital had gotten to level 4. Level 5 is the last stage. People go around regularly to check. So you're on your toes to ensure that everything is happening perfectly. But if we don't have all those things in place, people are left alone, anything can happen at any time, particularly when maybe the doctor is tired and all that, when the environment is not favorable. So those are the things major things that lead to negligence. It's not as if maybe the doctor is not well trained. Many of us, we have very good medical schools that can actually measure up to international standard.
Yeah, sure.
But take, for instance, the situation where maybe a material was left in the womb of the woman, that the doctor, it's not that the doctor was not well trained. Do you follow? But there are some situations, around, that the environment made them more predisposed to having that negligent incidents, which can actually happen anywhere, can happen in any country. So I don't know what our own percentage is, but 10% in the US is quite high too. It's quite high. So, but if the government is able to work in and put in, conditions that make the doctors happier, we have enough pay. Those that are on duty, you are ensured of having a good meal. Then all those other things that go to make the doctor happy, make the health worker happy. I'm sure those things will go a long way to ensuring, and then also there's enough money in the health sector. So that all the, all the machines we need to use are in place.
Available. Yeah.
Because there's just so much that a human being can do. If the machines are also there to help and make the work easier, then I'm sure we'll have less experiences concerning negligence.
All right. But still on that issue of burnout, being overworked, being underpaid. Now, I want to give you an instance where a medical practitioner is being, doing the work of about 3-4 medical practitioners, burnout, underpaid, overworked. And let's say the individual is meant to go into surgery as at that particular time, knowing fully well that he has not had sleep for about 72 hours, because we had one incident of a medical doctor that actually died because he was on call for 72 good hours. No break, no rest, no sleep. He actually died. Just slumped, then died. So now, what do you feel they can actually do? Because I realized that most of your answers were based on public hospitals. Government funding, all of that, public hospitals. What of the private hospitals that are managed or co-managed by one individual, 2 individuals? Such cases, most of them won't want to lose their jobs, so they will have to work. So what are your advices? I actually feel this is an ethical crisis, something that most people, because it is not based on them to just go ahead, make mistakes, deal with human lives anyhow, but some of them were actually burnt out, overworked and underpaid. So what do you feel they can actually do, or what do you feel can be done, especially for the private hospitals?
Okay, I think if there are good policies in place, that are being monitored from time to time to ensure that people are adhering, to those conditions, it will help. I always marvel at a scenario that happens. You know, you have maybe like 4 doctors in that private hospital.
Okay.
You know, and like abroad now, you're supposed to be a doctor to not more than 600 patients. You know, okay, their own system is a bit different. You know, but in our own place, we find out that because there are fewer doctors, you know, you have to be a doctor to like 2,000 or even more